Guys, we will be taking up a small topic in this video. It is all about diffusion of gas and oxygen transport. Okay, so we have covered entire points in the lungs, and let us get to know how air is being entering into the lungs, and the air that entered the lungs, how does it crosses across the pulmonary capillary barrier, reach the pulmonary blood. Okay people, so let us take up the alveolus here, and an alveolus is perfused by a pulmonary capillary. On one side we have venous blood entering with the partial pressure of oxygen at 40 millimeters of mercury and partial pressure of carbon dioxide at 46 millimeters of mercury. Now to know, just get to know this point doctors, I'll just tell you what is what, and you can just be familiar with the process, and you don't need to be taking down, or this process is important not for your entrance but to understand these diffusion mechanism. See, atmospheric pressure, total atmospheric pressure is 760 millimeters of mercury. Okay, atmospheric pressure is 760 millimeters of mercury, which is represented by ATM. ATM in your question paper represents atmospheric pressure. Normal atmospheric pressure at mean sea level is 760 millimeters of mercury, which will be called by 1 ATM. If it is given in your question as 1 ATM, it means that the pressure is 760 millimeters of mercury and they are talking about mean sea level, right? If you consider the total pressure, it is 760. Now atmosphere is in turn made of gases, out of which nitrogen is most abundant, that contributes to about 70% of total atmosphere. Oxygen contributes to 21% of total atmospheric content. Inert gases contributes to on an average of about 9% to the total atmospheric content. And finally, we got carbon dioxide, which contributes to 0.003%, practically 0%. Okay, so ignoring those decimals, it is going to be practically 0% in atmosphere, thanks to all those trees and greeneries. Okay, that sucks up all the carbon dioxide, leaving no trace to be seen in atmosphere. Now, people get to know this point. The atmospheric gas is, each of the gases contributing to its own proportion to the total atmospheric mixture. So the pressure contributed by every single gas to the net atmospheric mixture is called as partial pressure. So nitrogen at a fraction of 70%. Okay, so these values, let us address these values first. These values are called as fractions. So if your question paper gets with the terminology fractional concentration of inspired oxygen, it means they are talking about 21%. Okay. Now similar kind of questions you will be getting in anesthesia, where if a patient is put on 100% supplemental oxygen, for that patient fractional concentration of inspired oxygen will be 100% on a patient with, or any subject with supplemental 100% oxygen. Only if someone is breathing room air will be having 21% of oxygen. If a subject is being put on with mask and if you administer 100% oxygen, the fraction is 100%, right? Every single molecule getting into the system is just oxygen. So guys, this is about the percentage. Now if you look at the partial pressures contributed by those gases, okay, 21% of oxygen contributes to a partial pressure of 149 millimeters of mercury, while 70% of nitrogen contributes to about 560 millimeters of mercury, right doctors? And inert gases, they contributes to somewhat about 20 millimeters of mercury, carbon dioxide practically 0. So these values, okay, 560 millimeters for nitrogen, 149 for oxygen, these values are called as partial pressures. Okay, now be very clear in this topic. When do we have something called as partial pressure? Only when the gas is in its free form. This form of gas is what is going to exert a partial pressure. I'll tell you an example, my dear friends. You go home and you see a cylinder in your kitchen, or you will be using your body sprays, deodorants, isn't it? Now your cylinder do have LPG gas, your body spray deodorant do have gases. Now do these gas contributes to partial pressure of atmospheric mixture? No. The reason is those gases have been put inside a container. So a gas that has been put inside a container will not going to exert a partial pressure. So for a gas to exert a partial pressure, it needs to be in its free form. This is exactly what happens in hemoglobin. If you take up hemoglobin and if you use oxygen with hemoglobin, the oxygen that is combined within the hemoglobin is present within an RBC, isn't it? RBC consists of hemoglobin to which oxygen is binding. So this oxygen combined with hemoglobin and put inside an RBC is not going to contribute to partial pressure. On the other hand, the oxygen that is going to get dissolved in plasma without combining with anything is the one that is going to contribute to partial pressure of oxygen in plasma. So with this logic and understanding, if you could able to see the venous blood, I just told you partial pressure of oxygen in venous blood is 40 millimeters of mercury, partial pressure of carbon dioxide in venous blood is 46 millimeters of mercury. That tells you more amount of carbon dioxide has been diluted in the plasma compared with oxygen. If you look at the atmosphere, as I told you, you do have partial pressure of oxygen in atmosphere as 149 millimeters of mercury. As this gas enters into our body, we do have the gas that has been entering into our nasal passages. These gases are moistened, these gases are condensed, these gases are humidified by the nasal epithelium. The nasal epithelium, nasopharyngeal epithelium, oropharyngeal epithelium and laryngeal epithelium, they will be continuously adding water vapor to the incoming gas, right? In order to make the gas soft, in order to moisturize the gas, our body cells will be adding water vapor. Water vapor, though it is a water droplet, it behaves like a gas, which is why the name is water vapor and not water droplet. Okay, doctors. Now this water vapor being a gas comes with a partial pressure. Now that partial pressure of water vapor will be 47 millimeters of mercury. Now get to know this point, doctor. Among a mixture of a gas, every single gas is contributing to the total mixture. So there is a partial pressure of each and every gas contributing to the total pressure of the mixture. Now among the mixture, if you add a new gas, right, remember the total pressure does not change. At mean sea level, if the total pressure is 760 millimeters of mercury, there is not going to be any change in the total pressure. For example, we had a disaster happen in our country, past few years back. There was a huge toxic gas that got released from a chemical plant at Bhopal. Okay, when that gas gets leaked out, the whole atmosphere is polluted with that gas. Many people died by inhaling the gas. Now, if you would have measured the total pressure of atmosphere at that time, the pressure would still be 760 millimeters of mercury. But if you would have measured the partial pressure of nitrogen, partial pressure of oxygen, partial pressure of inert gases, everything would have been dropped. The reason is, with admixture of any new gas to the total mixture, partial pressure of existing gas will decrease and the atmospheric mixture also experience the same thing. So my dear friends, when you inhale air, you will be inhaling oxygen with a partial pressure of 149 millimeters of mercury. As this gas is being moistened, as this gas is being diluted by addition of water vapor at a partial pressure of 47 millimeters of mercury, there will be a reduction in partial pressure of oxygen. This leads to reduction of partial pressure of oxygen, and when this oxygen finally reaches alveolus, partial pressure of oxygen will be 149 minus 47, it will be 102 millimeters of mercury. Okay. Now partial pressure of carbon dioxide in alveolus. See, as I told you, atmosphere has got no carbon dioxide, absolutely no carbon dioxide. So it will be frankly zero. But because there is going to be a continuous transfer of carbon dioxide from pulmonary capillary into alveolus, the pulmonary capillary will have a carbon dioxide content and a partial pressure of 46 millimeters of mercury. We just saw that. Now, because of continuous diffusion, there is going to be a constant presence of carbon dioxide to some extent within the alveolus. Not only that, alveolar cells are also going for metabolism, themselves will be adding carbon dioxide to the alveolar cavity, thereby the carbon dioxide content and pressure of carbon dioxide in alveolus will be 40 millimeters of mercury, right. So, venous blood flows into pulmonary capillary with a partial pressure of 40 for oxygen and 46 for carbon dioxide. Okay. If you look at the partial pressure of oxygen in alveolus, we do have 1 or 2 millimeters of mercury. So, for gas transfer, for oxygen transfer, there is a gradient 1 or 2 in alveolus and 40 in venous blood. So, naturally the gradient drives oxygen to move from alveolus into pulmonary capillary. So, there is transfer of oxygen from alveolus into pulmonary capillary, doctors. This is one very pivotal point. If you look at the way the oxygen is getting diffused across the membrane, the diffusion of oxygen is governed by a law called as Fick's law of diffusion. It is called as Fick's law of diffusion. Now, Fick's law states that rate of diffusion, friends, get to know this point, we have something called as rate of diffusion is directly proportional to number 1, surface area of membrane. Number 2, concentration gradient. In terms of gaseous molecule, we can also use this as pressure gradient, and rate of diffusion is inversely proportional to thickness of membrane. It is inversely proportional to thickness of membrane, doctors. Okay. So, rate of diffusion is inversely proportional to thickness and it is directly proportional to surface area as well as pressure gradient. This law is called as Fick's law of diffusion. We will see this law in cell physiology also, doctors. Okay. So, this is the law, this is the parameter that governs the diffusive property of oxygen. Now, there is a constant called as diffusion coefficient. Constant called as diffusion coefficient, which in turn is separately governed by an equation called as Stokes-Einstein equation. Let us not distract ourselves too much into those and all. Simply speaking, diffusion coefficient says that diffusion is directly proportional to, rate of diffusion is directly proportional to temperature and directly proportional to solubility and inversely proportional to molecular size. Molecular size also called as radius of molecules. So, with increased temperature, diffusion increases. When I call solubility, it is nothing but lipid soluble. Any membrane is made of lipids, and when a molecule do have a solubility across a lipid layer, if it is a lipophilic substance, it will have a better diffusive property rather than a hydrophilic substance. Third one, molecular size. With increase in size of the molecule, the chances of diffusion comes down proportionally, because bigger molecule need a bigger space. When there is no space available, those molecules cannot able to transport across. This leads to failure in diffusion. So, my dear friends, these are the parameters that facilitates diffusion, doctors. Okay, and this is called as Fick's law of diffusion. Through these parameters and facilitated by all these concentration gradient, pressure gradient, we get transport of oxygen from the alveolus into the pulmonary capillary. Right now, if you look at the pulmonary capillaries and you take up an alveolus here, the moment oxygen gets out of pulmonary capillary into blood, all these oxygen will be collected by RBC, doctors. So, oxygen is going to combine with hemoglobin to form a compound called as oxyhemoglobin. Oxyhemoglobin is the major form of oxygen carrying mechanism in blood, and when all the RBCs are saturated with oxygen, we do have the second form of oxygen which is seen dissolved in plasma. This form of oxygen which is dissolved in plasma is called as dissolved form. Now 2 points you got to be familiar in this concept. Oxyhemoglobin form of oxygen is the way with which 97% of oxygen is being carried. 97% of oxygen in blood is being carried in the form of oxyhemoglobin. When it comes to dissolved form, only 3% of oxygen is transported as dissolved form. Only 3% of oxygen is transported as dissolved form. As I discussed previously, it is this 3%, my dear friends, please be very clear here. It is this 3% that contributes to partial pressure of oxygen in plasma or blood for that matter. So whatever we write as PO2 stands for dissolved form of plasma. This PO2 is the reason with which the oxygen transport from the alveolus to the plasma stops. As I told you, you have a partial pressure of oxygen as 102 millimeters of mercury. Now by the time it comes to 102 millimeters of mercury in plasma, the pressure gradient is lost. Okay. Now if you could look at in a deeper way, this 102 millimeters of mercury, by the time it gets reached, it gets equalized, 102 of PO2 in alveolus, 102 millimeters of mercury PO2 in pulmonary capillary, when they become equalized, all we could able to carry is just 3% of oxygen, which is absolutely inefficient to survive. This 3% of oxygen is tremendously inadequate. We can't even move a little finger with this 3% of oxygen, which will be absolutely inadequate for survival of life. So my dear friends, by any means we can't afford to let the oxygen to stop moving from alveolus to pulmonary capillary. To overcome this problem, God has given us red blood cells that keeps on gaining oxygen within it. As these oxygen is getting stuffed within a red blood cell, the stuffed oxygen within a container called red blood cell is not going to contribute to partial pressure. So there is not going to be any increase in partial pressure. So 97% of oxygen will comfortably be travelled without even increase in a speck of partial pressure of oxygen. When all the RBCs are saturated, only then the oxygen is going to start getting dissolved in plasma. That dissolved form of oxygen is going to add to the partial pressure. Once it reaches 1 or 2 millimeters of mercury, the transport stops. Okay. So remember, 97% of oxygen is being carried in the form of oxyhemoglobin. Simply 3% of oxygen is carried in the form of dissolved hemoglobin, and that is the fellow who is going to contribute to partial pressure, my dear friends. Okay. So this is the way with which oxygen is getting diffused across the alveolus, pulmonary capillary into the pulmonary blood vessel. Now let us move on to discuss about the transport of oxygen. Now when it comes to transport of oxygen, as I told you, it is primarily by oxyhemoglobin form. So the method with which oxygen combining with hemoglobin and the way it is being carried in blood is studied with a graph called as oxyhemoglobin dissociation curve. Oxygen hemoglobin dissociation curve. Another important PG entrance topic. So let us take up a graph. Friends, on the y-axis I am taking percentage of hemoglobin being saturated with oxygen. On x-axis I am taking partial pressure of oxygen. On x-axis I am taking partial pressure of oxygen. So by any means you can't afford to make two mistakes in this diagram. Point number one, in a normal physiological limits, when the lungs are functioning well, when blood is functioning well, there is no anemia, everything is going on the right side, it takes 50% of hemoglobin to be saturated with oxygen. All the 50% of total body hemoglobin to get saturated with oxygen, it takes a partial pressure of just 27 millimeters of mercury. At a partial pressure of 27 millimeters of mercury, 50% of hemoglobin is being saturated with oxygen. Now this partial pressure is called as P50. the partial pressure at which 50% of hemoglobin is saturated. In normal circumstances, in physiological limits, P50 is nothing but 27 millimeters of mercury. Now, if you look at the architecture of hemoglobin, friends, we have hemoglobin molecule with 4 heme and 4 globin chains. So, 2 chains may be alpha and 2 chains may be beta. Okay. So, this part is globin chain, the head part is heme, doctors. This is heme attached to globin, right. Now, what happens is, if you consider a molecule of oxygen, and all these things are connected, of course, okay, they are connected to each other by bonds. Now, basically speaking, the affinity of hemoglobin to oxygen is not very great, okay. So, usually hemoglobin molecule in a deoxygenated state will not intend to combine with an oxygen molecule. But what happens is, when there is a binding of first molecule of oxygen, when there is a binding of first molecule of oxygen with the heme, okay, so this part is the heme part, with molecule of an oxygen combining with the very first heme, this leads to, okay, increase in affinity of second heme to oxygen. So, the second molecule of oxygen combines with the second heme with a greater affinity. So, let me draw this with a greater affinity, doctors. There is going to be a increased affinity of oxygen for the second heme. Now, when the second heme moiety is being combined with oxygen, this leads to a significant increase in affinity of third heme to oxygen. This leads to a very vigorous binding of oxygen, doctors. This leads to a very vigorous binding of oxygen in a huge fashion. So, and this leads to severely increased affinity O2 for fourth heme. So, there is going to be a significant increase of oxygen binding for the fourth heme. Now, this way of continuous progressive increase in affinity of oxygen for a hemoglobin molecule will be increasing with every single molecule of oxygen binding to the every single heme. Now, because the binding happens in a progressive way and the affinity increases in a progressive way, this leads to oxyhemoglobin curve to be formed in a sigmoid shape. Okay. So, there is going to be a less affinity and less binding of hemoglobin at initial partial pressures. Yeah, that's better. So, this is how oxyhemoglobin dissociation curve looks like. Now, in this picture, if you could able to see this curve as it is coming to the top, this curve will not be exponentially progressive, it gets flattened at a point, doctors. Now, when you look at the percentage of hemoglobin where the curve gets flattened, okay, let us look at the percentage of hemoglobin where the curve actually gets flat or stopping, okay. Now, this point will represent a percentage of hemoglobin to just 97%. So, the point here is hemoglobin will never ever be 100% saturated. The maximum saturation of hemoglobin that can be seen with normal partial pressure of oxygen is just 97%. Okay. So, question number 1, why 97%, why not 100%? Because not all the hemoglobin present in the body belongs to the same category of alpha 2 beta 2 chains. There are other forms of hemoglobin like methemoglobinemia, sulfhemoglobinemia, as well as other abnormal hemoglobins, other forms of hemoglobin. Even in a very minor composition, these kinds of hemoglobin has got a very decreased affinity for oxygen. Because of their less affinity, they don't combine with oxygen. Due to that reason, we can never have 100% of hemoglobin absolutely saturated with oxygen. This slab is just 97%, doctors. So, in this graph alone, you got to be familiar with 2 points. Number 1, P50 is 27 millimeters of mercury. Number 2, the reason for sigmoid shape of the curve. Why is the curve sigmoid? The sigmoid shape of curve is because of progressive increase in affinity. Progressive increase in affinity of hemoglobin to oxygen, so that you will have an initial flat phase. The curve will not be exponentially rising. There is going to be a flat phase, over then the curve gradually rises. Now if you look at the point where the curve is about to get flat, now at this point doctors say, for example, this is the region where the curve is about to getting flattened. Till then there is going to be a sharp rise in the curve. The partial pressure of oxygen seen at the point of flattening of curve will be just 60 millimeters of mercury. Okay, and the point here is, till partial pressure of oxygen in arterial blood falls to 60 millimeters of mercury, literally 90% of hemoglobin will be saturated. Okay, so by 60 millimeters of mercury partial pressure of oxygen in arterial blood, we will have 90% of hemoglobin saturated. This is because the reason behind a patient who is progressively getting desaturated does not manifest with symptom, right? When a patient is going for desaturation, okay, till he falls to 60 millimeters of mercury partial pressure, the normal partial pressure of arterial blood, partial pressure of oxygen in arterial blood is 98 millimeters of mercury. Okay, the normal partial pressure is 98 millimeters of mercury. So by 98 millimeters of mercury, you will be having 97% of hemoglobin saturated, right? When the oxygen is getting out of the system, and if the oxygen is not getting into the system, both are coming to a same meaning, right? Till the partial pressure is falling to 60 millimeters of mercury, the subject will not experience any profound symptom, because till then 90% of hemoglobin is comfortably saturated with oxygen. It will not produce any acute symptom, doctors, right? Which is why the saturation, you remember 97%, 90%, these are all saturation which are nothing but SpO2, saturation percentage of oxygen, which will be monitored by pulse oximeter, right? So what happens in this COVID situation, when patients are asymptomatic, when we don't have bed, when there is no acute reason for a patient to get admitted in hospital setting to treat for COVID infection, what do we do, friends? We give them pulse oximeter, or we look for saturation. If we ourselves, doctors, get infected with COVID, what do? We take a pulse oximeter and we will be keep on looking for saturation. As long as the saturation is more than 95%, remember, as long as the saturation is more than 95%, it is not a problem. But when saturation is falling less than 95, we tell our own colleagues to come and get admitted, because there is a progressive desaturation. Why is this so? Though the subject is not experiencing any symptom, we admit them, because as long as the saturation is being maintaining around 90%, the subject will not experience any symptom. Now look at here, doctors, if the saturation is 90%, what can be the partial pressure of oxygen? It is just 60 millimeters of mercury. So till the fall reaches 60 millimeters of mercury, the subject will not experience any significant symptoms, because 90% of hemoglobin is saturated, which is why we don't rely primarily on the symptom of a COVID patient. If we see desaturation in a pulse oximeter, we encourage the patient to get admitted. It is a time for in-hospital admission treatment. The reason is, subsequent desaturation will happen without causing any symptom. Fine, friends, okay? So this is the curve, this is the reason for shape, why 97%, why not 100%, and the value of P50. Now the second points you need to know in a oxyhemoglobin dissociation curve is shifting of curve to right and left. Let us consider a normal oxyhemoglobin curve and curve which is getting shifted to right. Right shift of curve. On the other hand, we have certain conditions that makes the curve to get shifted to left. So left shift of curve. Needless to explain, it is very obvious right from the diagram itself. For a same partial pressure, of oxygen in blood, we do have 3 levels of saturation. A normal saturation will be comparatively higher. Okay, friends, we have a comparatively normal saturation first. This is normal saturation. Say for example, it is going to get saturated about 70 percentage, and for a same partial pressure of oxygen in right shift it is going to be simply about 50 percentage. On left shift the saturation is going to be much higher, it's going to be somewhat about 90 percentage. Now for a same partial pressure, that's the beauty here, okay, for a very same partial pressure we are getting three different types of saturation, okay. Now what are the causes that are involved in shifting the curve to right as well as left? Let us take up right shift, doctors. Right shift indicates decreased affinity for oxygen. Hemoglobin expresses decreased affinity for oxygen, and this is right shift. What are the causes? Number 1, when in the presence of H plus ion, okay, which means when there is less pH, acidosis, or in the presence of H plus ion, hemoglobin tend to remain in a deoxy configuration rather than in a oxy configuration, okay. Hemoglobin tend to remain in the unbound state rather than in a bound configuration. So this stabilizes the unbound form of hemoglobin, thereby hemoglobin loses oxygen, thereby the saturation falls, curve gets shifted to right. Point number 1 is acidosis, decreased pH. Point number 2, increased temperature. Point number 3, hypercapnia, that is increased partial pressure of carbon dioxide. Point number 4, increased presence of an enzyme 2,3 biphosphoglycerate or diphosphoglycerate, bisphospho or diphosphoglycerate. So these are the factors that shifts the curve to the right. Now simply stating all these factors, doctors, all these factors promote stabilization of hemoglobin in deoxy form itself. So the conversion of hemoglobin into oxyhemoglobin will be prevented or inhibited by these factors. When it comes to H plus ion, you also need to know an extra point in detail, that is friends, H plus ion, when it comes to hydrogen ion, there are two causes, two ways H plus ion can be increased. Point number 1, you can have increased presence of carbon dioxide. We will take option 3 also here. You can have increased presence of carbon dioxide. Because carbon dioxide is more, there is going to be formation of carbonic acid. This carbonic acid is going to split up into H plus and bicarbonate. Now this H plus ion promotes destabilization of oxyhemoglobin and favors deoxyhemoglobin formation. This happens in a much significant fashion. On the other hand, there can be other causes of metabolic acidosis. Other causes of metabolic acidosis, this is going to put H plus ion concentration increased in plasma. Now this H plus ion also is going to contribute to stabilization of deoxyhemoglobin, but this effect is comparatively lesser and smaller when compared with effect contributed by carbon dioxide. Now for your important reference, my dear friends, the acid produced because of carbon dioxide load, carbon dioxide induced formation of carbonic acid, and that carbonic acid is going to split into H plus, which is going to destabilize the oxyhemoglobin. This effect is called as Bohr's effect. Primarily Bohr's effect is nothing but carbonic acid induced serious destabilization of oxyhemoglobin and tremendous level of stabilizing a deoxyhemoglobin form. When it comes to other acids, presence of other acids is not going to shift the curve significantly to the right. For example, I am saying let us consider metabolic acidosis like diabetic ketoacidosis, lactic acidosis. In such cases, will there be a right shift of curve? It is much less pronounced. You can even have a normal oxyhemoglobin form because that acid is not a carbonic acid. So right shift of curve is primarily seen with carbonic acid rather than other forms of acid, doctors. So these four are the parameters that shifts the curve to the right. Let's discuss the parameters that shifts the curve to the left. number 1 exactly opposite functions, okay. Increased concentration of bicarbonate, that is going to increase the pH level. Alkalosis. Number 2, decreased temperature. Number 3, increased partial pressure of oxygen rather than carbon dioxide, increased partial pressure of oxygen. Number 4, decreased concentration of 2,3 diphosphoglycerate. Number 5, presence of a different kind of hemoglobin called as hemoglobin F, fetal hemoglobin. These are the conditions which shifts the curve to the left, which means there is going to be increased affinity. Hemoglobin has got a increased affinity for oxygen, and this increased affinity will shift the curve to the left, my dear friends, okay. So this is the right shift and left shift of curve and how oxygen is being transported in the blood. Right doctors, this completes our oxyhemoglobin dissociation curve. Now that completes our diffusion of gas and transport of gases to the tissues. Now in the next video, let us discuss about the respiratory control and how regulation of respiration has been taking place. So thank you.